Hi, I'm Keith Bodger. I'm a gastroenterologist in Liverpool and an academic at the University of Liverpool. I think randomised controlled trials are absolutely vital, and they are they sit at the top of the hierarchy of our evidence. And in terms of establishing whether drugs are effective and safe in a very controlled way, I think there's an increasing recognition that when we're trying to make decisions about what treatments are best and how effective treatments are, the randomised controlled trials are a starting point, but very often we have a deficit of data that tells us really how effective things are in the real world. Whilst there are challenges with real-world data, and certainly a great deal of care required in interpreting real-world data, it can answer different questions, and the sorts of questions we want to answer are really whether in the routine practice of NHS care, whether the agents that we're using or the treatment decisions we're making are actually delivering the sorts of outcomes that we expect, and whether we can focus our attention on refining the case selection and the drug choices that we currently make based largely on randomised trial evidence. The recognised challenges for the registry is to demonstrate its value back to the busy clinicians and teams at the front end who are being tasked or asked to collect data. Well, why would you? And I think the key message is that if you collect the data, then some value will come back. And actually what the project is about is twofold. Firstly, an engagement process whereby we start to disseminate examples of how the data, when linked to the routine information that all hospitals collect, how it might look, what sorts of outputs and metrics we might be able to generate, but feed that back to the front line such that teams can then start to comment, report on face validity, and drive, if you like, bottom up the development of useful measures that will actually inform maybe day-to-day decision making, but certainly the planning and the commissioning of their local services. So that's the iterative feedback component of the project. We also want to build a number of sites that have pushed the boat out and tried to capture the local population of IBD patients completely, because we think that's where the real power of the registry comes. Once you do have really quite small amounts of information registered, but most of your locally treated patients in the system, the dividends in terms of the routine data and the sorts of measures we can start to produce, I think, are very great.